Good morning everyone. Today we are going to talk about nasal polyps. Nasal polyps are hypertrophied edematous and prolapsed pedunculated mucosa that is coming out of the nose and paranasal sinuses. These are non-neoplastic masses and the properties of nasal polyps are they are pale grey in color, they are glistening, they are pedunculated, insensitive to touch, they are mobile and does not bleed on probing. And it is mainly divided into two main varieties that are antroconal polyp and ethmoidal polyp. Moving on to the antroconal polyp, they arises from mucosa of the maxillary antrum near its accessory ostium, and it comes out of it and grows into choana and nasal cavity, and it has four parts and they are antral, nasal, conal and neck. Antral is a thin stalk, whereas nasal is flat from side to side, conal is round and globular, and neck part is present at maxillary ostium. Moving on to the clinical presentation, it is most commonly seen in child and adolescents, and the symptoms is the patient presents with unilateral nasal obstruction, unilateral nasal discharges with mostly mucoid discharge, and the voice may become thick and dull due to hyponasality. And talking about the signs, it goes posteriorly, so it is missed on anterior rhinoscopy, and it is large, smooth, greyish mass which is covered with nasal discharges, and it is soft and can be moved up and down with a probe. On probe test, in antroconal polyp, it is very much insensitive to pain. The probe can be passed all around the polyp. It is mobile. And in hypertrophy turbinates, they are very sensitive to the pain. Probe cannot be passed around it, and it is not mobile. And the differentials for the antroconal polyp are hypertrophied inferior turbinates, blob of mucosa, inverted papilloma, rhinosporidiosis and rhinoscleroma, angiofibroma, meningocele and malignancy. And antroconal polyp goes posteriorly because maxillary ostium is directed posteriorly, the cilia beats posteriorly, the ear current also flows posteriorly, and the nasal flows are also slopy towards posterior side, and the posterior nasal cavity is also larger, and there is negative pressure in the oropharynx. And for the investigations, we can do diagnostic nasal endoscopy. We can do the X-ray of the paranasal sinuses in Waters view. We can do the X-ray of nasopharynx in lateral view, which will show the presence of ear between skull base and polyp. And we can do the CT scan of PNS also. And moving on to the treatment, antibiotics can be given preoperative and postoperative. Avulsions polypectomy with middle meatus antrostomy can be done. And FESS, that is functional endoscopic sinus surgery, can also be done. And it is nothing but a minimally invasive technique that is done intranasally using a rigid endoscope to provide adequate drainage and ventilation of the sinuses without the removal of the mucosal lining of the sinus. And there is Calwell look operation, and it is done for recurring cases, and it is a process of opening the maxillary antrum through canine fossa by sublabial approach and dealing with the pathology inside the antrum. And the treatment of choice is endoscopic sinus surgery. Now talking about the ethmoidal polyps. Ethmoidal polyp arise from ethmoidal sinus. They are multiple in number. They grow anteriorly, whereas antroconal polyps were growing posteriorly. And talking about the clinical presentation, the patient will be adult with bilateral nasal obstruction, and there will be bilateral nasal discharge as well, which is watery, and there will be excessive paroxysmal sneezing, and there will be history of previous nasal surgery as well. And talking about the etiology, it is mostly caused by the allergy, and allergy and infection can also be present. The infection may lead to the inflammations of the mucous membranes in the sinuses that may lead to the swelling and protruding of this mucosa into the nasal cavity, forming the polyps, and vasomotor imbalance, Bernoulli phenomena and polysaccharide changes are also responsible for the formation of ethmoidal polyps. And the associated diseases are Samtar's triad, cystic fibrosis, allergic fungal sinusitis, Carter-Jenner syndrome, and Young syndrome. Samtar triads is the triad of aspirin intolerance, ethmoidal polyp, and bronchial asthma. And for investigation, we can do diagnostic nasal endoscopy, X-ray of the PNS can also be done, CT scan can also be done, and test for allergies should be done. Moving on to the treatment of ethmoidal polyps, there is non-surgical treatment and surgical treatment. And in non-surgical treatment, it is for very small polyps, that is, we should avoid the allergens. Oral antihistaminics for 1 to 3 months should be taken. Corticosteroids nasal spray for 3 to 6 months can also be administered, and oral prednisolone 1 mg per kg per day for 2 weeks can also be administered. And in surgical cases, we can do intranasal avulsion polypectomy, extranasal external ethmoidectomy, transantral ethmoidectomy, and FESS. Thank you.